questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is for the Premier. I spoke last week of a young woman in Truro who was the survivor of sexual assault. She went to the Colchester East Hants Health Centre and did not receive the care that Nova Scotians would expect. According to StatsCan, in 2017, there were over 1,000 reported cases of sexual assault, and Mr. Speaker, a quarter of those were children. We know that instances of sexual assault are tragically underreported. Hopefully, we will see this start to change, but change will only come when this government changes. Stories like the one out of Truro are very discouraging to survivors who want to come forward. Will the Premier give survivors of sexual assault confidence they will be treated with compassion by putting in place dependable supports in every part of our province?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. She is absolutely right. When someone comes forward, Mr. Speaker, they need to be surrounded with the appropriate supports. They need to be done so, Mr. Speaker, in a timely manner. It's why in 2013 we invested in the first ever sexual assault strategy here in the province. We continue to invest in transition houses. She knows the Department of Justice provides support across our entire province. And the same program that the Honourable Member is referring to is one, Mr. Speaker, that we as a government are committed to ensuring is all across our province. What I said before, and I continue to say, the reason it's not in some places is ensuring that we have the appropriate training for those nurses that will need additional training that requires, and it takes time, and we're working with our partners to ensure that that happens.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. In January, community groups that support survivors of sexual violence in Nova Scotia said they'd likely have to turn people away without an extension of funding for the sexual violence strategy. The funding was $2 million per year. One advocate argued that it is unethical for the province not to offer a long-term solution, especially because more victims are coming forward. And I can table that document, Mr. Speaker. Despite all of this, the $2 million that is earmarked for 18-19 budget will be spread between domestic violence and sexual assault. No matter how you look at it, that means less money for sexual violence. Will the Premier immediately restore and enhance the funding for sexual assault victims?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. As she has alluded into her question, I want to remind her we were the first government to make an investment to ensure that we have a sexual assault strategy. We said at the very beginning that would be a 3-year program that we worked with our partners across the province. Following that, we built in for the first time ever $1 million into the base of the community service budget to deal specifically with sexual assault strategy. She would also know that we've invested through the Department of Justice across our province to make sure that we have supports working with. She would also know, Mr. Speaker, that we have dedicated supports in public prosecution to ensure that when someone comes forward, public prosecutors have the appropriate training to deal with this very important issue.
The Honourable Leader of the Official Opposition.
The last sitting of the Legislature, the PC caucus raised the issue of sexual assault outreach at the reduction in funding. We asked the Public Accounts Committee to examine the issue. The committee agreed, but the witnesses were never called, Mr. Speaker. The committee wrapped up its business 3 weeks early without addressing the issue. Now the government has wiped out the scheduled meetings, meaning it could be months before the topic is ever considered again. Will the Premier explain why this government is going out of their way to avoid talking to sexual assault victims?
The Honourable Premier.
I want to thank the Honourable Member for the question. I want to thank her again, and I want to remind her of the work that we've been doing with our partners across the province. I also want to remind her that the last time her party was in power, Mr. Speaker, we put on the floor of this legislature in opposition a bill around domestic violence, which, by the way, we've implemented when we came to government. Their party was prepared to trade it off on a scrap metal bill, Mr. Speaker. We don't say one thing in opposition, Mr. Speaker. When we have a chance to make a difference in the lives of Nova Scotians, we did.
The Honourable Leader for the New Democratic Party.
On the day following National Suicide Prevention Day, I want to point out to the Premier that if he or I or anyone should find ourselves today overwhelmed, and we should make our way to avail ourselves of the health authorities' community-based mental health services, for example, particularly in Halifax at Bayers Lake, we would be given an appointment to be seen by a clinician in 10, 11, 12 months' time. And so I want to ask the Premier if he will acknowledge that something is deeply out of whack when in our province, from one end to the other, we have people coming forward for help and having to wait 6, 8, 10, 11, 12 months just to get their foot into the door for an appointment.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. This very important and serious question. One of the members from the official opposition read a member statement as well in this House. We know that all of us have been impacted. And it is important that these services are made available across our province. We're working to continue to work with our partners to ensure that we do that. It's also important that we learn to identify the issue very early on in the onsets of mental health challenges that our loved ones are experiencing, our neighbours are experiencing. It's why we've made this investment early on in the education system to make a wraparound services to ensure that we get early detection, because we all know that the earlier we detect these issues, the better the outcomes.
The Honourable Leader of the New Democratic Party.
It is not a matter of what the Premier or the government intends. It is a matter of what the government achieves. The fact of the matter is that today, in Nova Scotia, we have a suicide rate considerably above the national average, while the percentage of our health budget, which is dedicated to mental health, is considerably below the national average. And we have a government which took funds away from Eating Disorders Nova Scotia, Schizophrenia Society of Nova Scotia, and the Canadian Association of Mental Health. So I want to ask the Premier if he can understand why there are a lot of people who feel that his government's record on mental health has fallen far short of what it should be.
The Honourable Premier.
For the question, Mr. Speaker, we continue to work with our partners across the province to ensure that we provide the supports that community members need, that family members need. Mr. Speaker, we as a government will continue to do that. I want to assure the honourable member we take the very issue that he's raised here in the House on the floor of the House of Assembly very seriously. The Minister of Health, along with his partners across the executive table, Mr. Speaker, continue to make sure that we have the supports in place. Is there more work to do? Of course there is, Mr. Speaker. There's always ongoing work, and we look forward to continuing to work with those partners to ensure that we continue to provide those supports to our communities.
The Honourable Leader of the New Democratic Party.
Yesterday, suicide prevention advocate Laurel Walker said in an interview, which I'll table, that no system, our system is built around Band-Aid solutions and only treating the worst when they have to go to the ER and they're really in a crisis. She said the funding for mental health in Nova Scotia is inadequate. I agree with her. The province is full of people who, on the basis of experience in their own families, agree with her. And I want to ask the Premier if he accepts what Ms. Walker has had to say as a fair characterization, a fair assessment of where we are after 5 years of the Liberal government on the file of mental health.
The Honourable Premier.
Speaker, I think an important part in the honourable member's question was talking about when people would present themselves in our healthcare facilities. What I've said very early on, we need to make sure that we have the supports there and in community-based mental health services. But I think it's equally as important, Mr. Speaker, that we recognize early detection of mental health issues is important for outcomes, important for the individual, and important for families. It's why we continue to make investments so that we can ensure that we can identify these issues early in the onsets with our children and with the wraparound and supports we're providing in the public education system, so we continue to have better outcomes, Mr. Speaker, for all of our families.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question through you is to the Minister of Labour and Advanced Education. Researchers call the first weeks of school the red zone because sexual violence spikes on post-secondary campuses. Students, particularly those in first year, face a higher risk of being assaulted during this season of back-to-school parties, new people, new places. Ontario, Manitoba, British Columbia, and Quebec all have legislation requiring post-secondary institutions to develop sexual violence policies. Nova Scotia doesn't. Will the minister act immediately to protect students by introducing legislation that requires Nova Scotian universities to put sexual violence plans in place?
The Honourable Minister of Labour and Advanced Education.
Mr. Speaker, I'd like to thank the member for bringing this issue to the floor of the legislature. I'd like to reiterate that what our government has done is put this strategy in place in the MOU. Every university is expected to have a sexual assault violence strategy in place. And as well, Mr. Speaker, not only did we put in the MOU, if the universities do not have it in place, there's financial penalties that the universities incur because of it. We felt that this was a very strong message to the universities. But, Mr. Speaker, more importantly, every university has been in step with our government, and they are bringing these sexual assault strategies forward because they know that even one sexual assault is one too many. Thank you, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker, and I thank the member for his answer. It does sound fairly positive. Student organizations are leading the charge to keep their members safe on campus, and I applaud them for this. Because of their efforts, the federal government is even considering withdrawing funding from universities and colleges that are not implementing best practices to deal with campus sexual violence. It is a clear indication that the time for talk is over, Mr. Speaker, and that there needs to be real, concrete action to help protect students. So in the absence of legislation, will the minister consider attaching financial consequences to schools that fail to take appropriate action, but let us know what those fines will be in total?
The Honourable Minister of Labour and Advanced Education.
Mr. Speaker, right now, what we've put forward to the universities, the fines will be their increases, which can be as much as $3 million per year. But, Mr. Speaker, I do want to say I want everyone in this House to know that the universities were part of the process. The student groups we're talking about were part of the process. They brought a sexual assault strategy forward to myself as the minister, and this was started under the previous minister. It was fully accepted. The universities are actually ahead of schedule implementing it. We're very pleased about that. And, Mr. Speaker, again, I will reiterate that, as we've heard in the legislature today, times are changing, and we are pleased that the universities are moving forward. We want victims to come forward, and we want no victims at all to have anything horrible like this happen to them. Thank you, Mr. Speaker.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. A question for the Minister of Health. Yesterday, the NSHA's Senior Director of Medical Affairs said that the Department of Health did not have a recruitment plan to pass along to the newly created Health Authority back in 2016. Seems odd, Mr. Speaker, to promise a doctor for every Nova Scotian 3 years prior without a plan for how to recruit them. So I'd like to ask the Minister, does the Minister think that 4 years is too long to wait for a plan while thousands of Nova Scotians don't have a family physician?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. As the member would know, part of the challenge I think that was being referred to is that you have a variety of different health authorities, districts within the province, different approaches to recruitment throughout the province. Bringing together a single health authority provides that opportunity to look at our province as a whole. This has resulted in a number of, I believe, improvements in identifying where needs are, how we implement, as the member mentioned, taking action with our incentives to help with recruitment, like our tuition relief program, and also our locum initiatives. Mr. Speaker, all of those initiatives taking place, and we've been learning from the experience and frontline healthcare workers to make those improvements on the ground.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. We know 56,000 Nova Scotians are on the waiting list for a family doctor, and last spring the minister did announce a suite of major incentives designed to encourage doctors to take patients off the waiting list, saying, Mr. Speaker, that these changes offered more choice and added incentives to practice here in Nova Scotia. However, Mr. Speaker, upon closer inspection, these incentives isn't available for physicians starting a new practice, for example. In fact, to be eligible for these incentives, physicians must have been practicing for at least 2 years or have more than 1,350 patients on their roster, Mr. Speaker. So can the minister explain why he suggested these incentives would bring more doctors, family doctors to Nova Scotia, when it excludes those at the very beginning of their career, Mr. Speaker?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for taking the opportunity to bring the suite of incentives that we announced in the spring that we developed in collaboration with Doctors Nova Scotia, Mr. Speaker, to the floor of the House. The member is making reference to one particular incentive out of a suite of about 5 or 6 different initiatives, Mr. Speaker. The one that he's referring to was designed to encourage the expansion of existing collaborative practices and comprehensive family care being provided in the province to attach patients to a family practice. The other incentives, Mr. Speaker, that we've provided include increasing the compensation for comprehensive family care, Mr. Speaker. It's incentives like that, increasing the compensation that's available to our physicians, that's attractive not just for retaining physicians, but also recruiting new ones.
The honourable member for Cole Harbour Eastern Passage.
Mr. Speaker, my question is to the Minister of Community Services. In a presentation to the Standing Committee on Community Services, the Sexual Assault Services Network of Nova Scotia said there is no statistical indication that the Liberal sexual violence strategy has reduced sexualized violence in Nova Scotia. In fact, they said the strategy increased the demand for comprehensive services as people are more often coming forward to report sexualized violence. Unfortunately, the same group of advocates said that long-term comprehensive services are not available. And as a healthcare professional in Nova Scotia, I have seen the lifelong consequences on one's mental and physical health when those services are not provided. My question to the minister is, why has the Liberal government refused to provide funding for long-term comprehensive services for survivors of sexual assault?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker. I will address my answer to services provided by community services. I want to confirm for the honourable member that we do in fact provide services for the prevention of sexual assault through the Department of Community Services. We have $1 million in funding going forward, prevention innovation grants, Mr. Speaker, and I would note that I would not simply take our plan to combat sexual assault as the cause for more people coming forward. I think the Me Too movement had something to do with that, and I commend those who have come forward. Thank you.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. On behalf of anybody who has ever experienced a sexual assault, $1 million in prevention is nowhere near enough. So my question to the Minister of Community Services, the story of the young woman who waited for 3 days to get a SANE exam and the horrific story of the young Truro woman who was turned away from a hospital without any care show that short-term services for victims of sexual assault are inadequate. And experts in the field say that long-term services are not available but are critical. In Nova Scotia, we do not have these services available, and the majority of people who are sexually violated are done so by someone that they know, making this an even more complex issue. So my question to the minister is, will the minister admit that the province has not done enough for sexual violence victims and to act immediately to ensure that there are greater services both for prevention as well as appropriate services for long-term care available when and where they are needed?
The Honourable Minister of Community Services.
I want to thank the honourable member for her question, and we always want anyone who is the victim of sexual assault to have the kind of supports that they need to get over this. What I will say is that we do have an online training course, Mr. Speaker, that helps all of us better provide support for people who are victims of sexual assault. I would encourage all members of this House to reach out and take that Supporting Survivors of Sexual Assault course. You can do it online. Mr. Speaker, we are also developing programs that better reach those who often don't come forward, because what we do know is that young people, and often particularly women, but people in marginalized communities like Aboriginal Nova Scotians, African Nova Scotians often don't come forward. So we are, in fact, working on providing better services to those populations as well. Thank you.
The honourable member for Cape Breton, Richmond.
Thank you, Mr. Speaker. In 2015, Nova Scotians were horrified to learn that a victim of sexual violence was forced to wait 3 days for a sexual assault nurse examiner team to travel from Antigonish to New Glasgow. To make that awful story go away, this government told Nova Scotians not to worry. They were investing $700,000 to expand the sexual assault nurse examiner program to Cape Breton and the South Shore. Nova Scotians trusted this government to keep its word to them and to survivors of sexual assault, but the trust was misplaced, Mr. Speaker. More than 3 years later, the SANE program has not been established in Cape Breton. Mr. Speaker, it's 3 years. Why hasn't the minister followed through on the promise to provide these crucial services to the people of Cape Breton Island?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for raising the question. Indeed, Mr. Speaker, we've been following through with this commitment to expand SANE services, and the member's preambles made reference to New Glasgow. I had a meeting earlier this week with the Antigonish Women's Resource Centre, which provides SANE services in the Antigonish and surrounded areas, including coordinating the services out of the New Glasgow region. Mr. Speaker, it was a very positive meeting. They appreciate the work that we're providing and the support that I've provided both as MLA, Mr. Speaker, advocating on their behalf long before I came into this position. The work for expansion in the SANE services, just as recently as last week, program was launched in, I believe, the Yarmouth community. Work is ongoing. As the Premier said in an earlier question, it takes time to get people the training that they need to fulfill the requirements and deliver those services.
The Honourable Member for Cape Breton Richmond.
Mr. Speaker, I'd like to take this opportunity to remind the Minister that New Glasgow is not on Cape Breton Island. 3 years ago, women were forced to wait days for a SANE examination. That is a situation that never should have been allowed to happen, Mr. Speaker. But, Mr. Speaker, things have become even worse. Very recently, we learned that a young woman who has been sexually assaulted was turned away from a hospital, having been given only some pamphlets, not medical advice, not an offer of a SANE examination. All our system could provide her was a few pieces of glossy paper. Mr. Speaker, how can Nova Scotians trust this minister to ensure victims of sexual assault get the care they need when they already let them down on a promise of a SANE program on Cape Breton Island?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And as I've mentioned, work is continuing with our partners throughout the province, expanding these services. Mr. Speaker, to the specific case that the member referenced about obtaining SANE services, obviously this program is relatively new in the history of the province. I want to assure her and all members of this legislature and the members of the public that having an assessment can be provided within hospitals throughout the province. Certainly there are enhanced services provided by SANE, the sexual assault nurse examiners, and that work is going to continue with these expansions, including Cape Breton, the South Shore, and as we've mentioned, Northern Shore as well.
The Honourable Member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Health. Every person who experiences sexualized violence should have the opportunity to present themselves at a hospital, if available, to have evidence collected by a healthcare professional. Every person who experiences sexualized violence should have the opportunity to report the incident to police in a respectful, safe, and trauma-informed environment. And every person who experiences sexualized violence, either recent or historical, should have access to a specialized sexual assault therapist. My question to the minister is, does the minister agree that it's only ethical to have these services available for all people who experience sexualized violence, no matter what part of the province they live in?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And of course, Mr. Speaker, we agree that services for people presenting as victims of sexual assault, sexualized violence, do need to get the care and compassionate way. I want to assure the member opposite that, in fact, they can present at hospitals and receive the examination by healthcare providers, by physicians throughout the province to collect the evidence. As we noted, the SANE program is an enhanced service that is also available in parts of the province. We've committed to continue the expansion of that program, and that work is ongoing, as recently as last week announcing the activation of that program in the Yarmouth region.
The Honourable Member for Queens Shelburne.
Thank Mr. Speaker. Mr. Speaker, people who experience sexualized violence live in different communities across our province, not just Halifax, Antigonish, Pictou, and Colchester County. People who experience sexualized violence should not have to tell their story over and over again as it re-victimizes them. People who experience sexualized violence deserve timely and confidential support by a professional who is appropriately trained in a safe environment. My question to the minister is he prepared to fund specialized sexual violence, trauma, therapeutic counselling in this current budget to all parts of the province, or is he okay with parts of the province not having access to this service?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Again, I thank the member for bringing this important issue to the floor of the legislature. Indeed, we continue to expand and provide services for people who have suffered sexualized violence. That included the services around sexual assault therapists, as well as the expansion of the SANE program, Mr. Speaker. This is work that's ongoing and will continue to expand across the province.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question is for the Minister of Labour and Advanced Education. When university students returned to campus last week, they returned to the fastest rising tuition fees in the country. This year, average tuition fees have gone up 5.5%, almost double the national average. And since this government came to office, they've gone up a total of 26%. We now have the second highest tuition fees in the country, and the minister's policies have us on track to have the highest. So my question for the minister is this: does the minister think skyrocketing tuition fees are good for Nova Scotia?
The Honourable Minister of Labour and Advanced Education.
Thank you, Mr. Speaker. It gives us an opportunity now to talk about the excellent universities we have in this province, as well as the excellent programs they offer. This is why university students from all over the country come here. We bring in more students per capita than any other province. Mr. Speaker, the member is right. The tuition fees reflect the quality of education, but Mr. Speaker, we could possibly have lower fees if the NDP hadn't cut 10% from the university's budgets.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
You know, Mr. Speaker, I am getting so tired of this government trying to throw a former government from like 7 years ago under the bus. Get with the program here, folks. Students are still telling us that they're leaving the province to pay off their debt, and it's not hard to see why. The average student debt in Nova Scotia is over $39,000, one of the highest in the country, and yet we have one of the lowest median incomes in the country as well. And in 3 weeks, we'll have the lowest minimum wage in the country. So in other words, the minister is forcing young people to take on some of the highest debt loads in the country and then enter one of the lowest paid labour markets. So my question, Minister, for the minister, is could he please explain why he thinks that putting young people $40,000 in the hole is such a great policy for Nova Scotia?
Honourable Minister of Labour and Advanced Education.
Mr. Speaker, it gives me another great opportunity to talk about our most generous student loan program, the most generous in the product. Mr. Speaker, when we came in, we eliminated the interest on our student loans. Then, Mr. Speaker, we went a step further and we said to the students, if you graduate, we'll completely wipe out your Nova Scotia portion. So, Mr. Speaker, while this government has increased the funding to universities every year, while the NDP cut out 10%, it's no wonder tuition fees rose. And Mr. Speaker, I will also like to add that not only did the NDP cut 10%, they enforced a freeze on the universities with no prior knowledge, and the universities were stuck with abnormal tuition fees. NASCAD was stuck offering 6 courses for the price of 4, which hurt them very badly. And then the NDP went a step further and they started threatening NASCAD to move them into Dalhousie University. Shame on them.
The Honourable Member for Inverness.
Mr. Speaker, a question for the Minister of Transportation. Mr. Speaker, over the weekend I was travelling through the Rotary at Port Hastings by the Causeway, and lo and behold, I looked and there was a car coming at me coming the wrong way with Pennsylvania license plates, traveled completely through the Rotary in the wrong direction. Very dangerous. Cars coming from all angles. Mr. Speaker, Nova Scotians are getting used to the rules for roundabouts. This is a Rotary with different rules. tourists are too busy trying to decide which route they want to take to enter Cape Breton Island or where they're going. They're not seeing the yield signs. Mr. Speaker, we've heard of millions of dollars being announced for highways in areas that aren't being twinned to improve safety. Can the minister provide an update on progress for changes that could come for the Rotary in Port Hastings?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and thank the honourable member for the question. He certainly provides a lot of vigilance for the entry to Cape Breton, which is, of course, very important. It definitely could require some upgrade. There's no doubt about it. It's in the long-term plan. I appreciate the advice in terms of what happened there on the weekend. Unfortunately, sometimes people get confused no matter where they're at, but we'll certainly take a look and see if the signage can be improved.
The honourable member for Inverness.
Well, Mr. Speaker, we certainly hear about it a lot. There's a lot of these incidents, and it's scary to see them happen with my own eyes. Mr. Speaker, I've also raised issues around delays with the swing bridge at the Canso Causeway. And there's an opportunity here. The Rotary and the Causeway traffic issues are all connected because they're so close together. I have advanced ideas, some of them of which have come from constituents, about improving traffic flow, particularly for people who don't even want to cross the causeway, who have to make it through that Rotary. Mr. Speaker, the minister knows the area well. He's a resident not too far away. Can the minister provide some indication before the end of this sitting that would suggest that the government is prepared to do something about the Rotary and the potential to improve traffic flow and improve safety?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and thank the member for the question. As the House is aware, the province recently took over responsibility for the causeway and the attendant issues that he speaks to with regard to the swing bridge that's in there. We were able to improve the bridge and improve the system that last year resulted in significant delays when the mechanism went down. So we've got to that point where we have local service which delays the time. Our department is looking at alternatives for rerouting some of the traffic that may not be going to the causeway, either coming out of 19 or coming up from the Port Hastings area, that would alleviate some of the bottleneck that occurs when the bridge does go down. Thank you.
The honourable member for Cape Breton Richmond.
Thank you, Mr. Speaker. I've communicated to constituents regarding the Lennox Passage Bridge that links the Alma Dam, to the rest of Cape Breton Island. It's had a rough summer this year, Lennox Passage Bridge. The bridge is the only way on and off Alma Dam, an island with approximately 4,000 residents. Minimal preventative maintenance has forced TIR to weld the span shut because of concerns the bridge might not shut again once opened. And so it has remained closed to marine traffic all summer long. This has impacted tourism and transportation not only in local marinas, but throughout the Brodeur Lakes and the rest of Cape Breton Island. TIR has issued an RFP, thank you very much, to repair the bridge with a total value of $2.9 million. My question for the minister is he confident that given the state of this bridge that $2 million this fiscal year and only $900,000 the next is enough to rehabilitate this bridge into an optimal working condition?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and thank the member for the question. Again, this is an aging piece of infrastructure that, interestingly enough, has a fairly ancient mechanism associated with opening and closing the bridge. And the estimate that she refers to is simply that. It's a shot at what we're thinking that the cost might be. And the tender actually has closed on the bridge, and we are currently evaluating just what we're going to do in that particular instance. Thank you.
The honourable member for Cape Breton Richmond.
Thank you, Mr. Speaker. I didn't realize that bridges that were built in the 1970s are considered ancient. I was born in that era as well, so maybe I'm considered ancient as well. I appreciate that the minister and the TIR employees are working hard to keep that bridge open to marine traffic, but they also realize, my community realizes that we've been having issues with this bridge now for close to a decade, and that the capital plan keeps kicking the can down the road on a sustainable fix. We now know that the tender for the repair work has come in, it's closed, it's come in over budget. As the tourism season comes to a close, Mr. Speaker, people in and around Cape Breton and Richmond are wondering if this will impact yet another tourism season next year. Will the department, Mr. Speaker, commit the necessary resource to complete bridge repairs in time for marine traffic to pass through over the next 2019 tourism season?
The Honourable Minister of Transportation.
Thank you. Thank you, Mr. Speaker. And it is our intention to, at this point, to have the work concluded before the beginning of the next tourist season, before the end of June of next year. Thank you.
The Honourable Member for Victoria, the Lakes.
Thank you, Mr. Speaker. It must be Transportation Day in Cape Breton, because my question as well is to the Minister of TIR. Last December, the Englishtown Ferry was supposed to be closed to all traffic until April of this year to allow for reconstruction of the ramps and other improvements. Well, Mr. Speaker, April has come and gone, and so have the months of May, June, July, and August. Now we're past Labor Day and still no ferry. This delay is causing worry in the surrounding communities, and rumours are starting to swirl about when and if the ferry is going to finally resume service. So my question to the Minister, will the Minister update this House on the status of the project and when these communities should expect to see their ferry operational?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker. The project at Englishtown has been affected, of course, by the Mother Nature and the challenges that represents when dealing particularly with ice scour in the area, and that delayed the actually resulted in a significant redesign during the project when it was underway. Recently, Transport Canada has okayed the operation of that facility, and there's some fine-tuning going on, and we're expecting that facility will be open, the ferry will be open to the public shortly. Thank you.
The Honourable Member for Victoria, the Lakes.
Thank you, Mr. Speaker. Well, shortly was also May, June, July, and August. Mr. Speaker, having the ferry closed for the last 9 months has inconvenienced residents and businesses and has caused emergency providers possible delays when responding to emergency calls. On April 5th, I rose in this House and shared the concerns of local residents and businesses because the ferry connecting tourists to the Cabot Trail would not be operational during the busy tourist season. Unfortunately for those residents and local businesses, Mr. Speaker, their worst fears were true. An incredible 9 months and the loss of a tourist season that helps local businesses get by during the winter months is gone. So my question to the Minister, will the Minister help to correct a wrong and commit to removing all the Englishtown ferry service fees, and if not, for at least 6 months following the ferry reopening, whenever that might be, in recognition of the inconvenience this project has caused?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. And I can certainly understand the frustration that particularly the local people are feeling with the loss of that vital service, which, when you consider, Mr. Speaker, represents quite a bargain for the users to be able to cut off that trip through Tarbert Vale and get to your destination much closer. There are costs associated with providing that cost, the same as there is in any of the other highway structures, and we'll be looking forward to getting that back in service shortly. Thank you.
The Honourable Member for Dartmouth North.
Speaker, my question is for the Minister of Community Services. Wood Street Secure Care in Truro is the highest level of treatment for youth under the care of the Minister. The facility houses some of the province's most vulnerable children and teenagers who are suffering from emotional and behavioural disorders. Residential caring facilities are allowed to use therapeutic quiet rooms, similar to solitary confinement. However, a letter received by our caucus through Freedom of Information indicates the department does not track the number of incidences of children in care of the Minister being held in close confinement or the length of time of each incident. Mr. Speaker, is the Minister satisfied that her department is unable to determine how many children in her care are being held in close confinement or for how long?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question, and I want to inform the honourable member that the safety and well-being of children in our care is our top priority. I do believe that in this particular case they asked for records that exist. Those records do not exist. We don't track that currently, but it is something that we could track in the future. Thank you.
The honourable member for Dartmouth North.
I'd like to thank the minister for that answer, and we look forward to getting those that data soon. Mr. Speaker, most youth in Wood Street facility are between the ages of 12 and 18. The department's policy on the use of therapeutic quiet rooms states, children who indicate a need to leave the therapeutic room due to sickness, need to urinate or defecate, circumstances involving menstruation or otherwise will be instructed that the request will be approved when the Chief Administrative Officer is satisfied that the child has demonstrated the ability to manage their behaviour. 12-year-old children, Mr. Speaker, held in close confinement and not allowed to go to the bathroom. Mr. Speaker, does the minister think that this treatment is appropriate for children who have been placed in her care?
The Honourable Minister of Community Services.
I want to thank the honourable member for her question, and I want to assure her that the safety and well-being of all children placed in our care and our authority is of the top priority. Thank you.
The honourable member for Pictou Centre.
Mr. Speaker, my question is for the Minister responsible for WCB. Mr. Speaker, the Workers' Compensation Board of Nova Scotia provides workplace injury insurance to a number of workers across this province. Therefore, when a worker gets injured on the job, they expect to have the peace of mind that they will receive compensation for their injury. Often, the WCB requires that an independent medical specialist offer an opinion on the injury at the centre of a claim. The Minister responsible for the Workers' Compensation Act stated in this House that he would expect WCB to honour the findings of an independent medical specialist. My question, could the Minister inform this House what is the definition of an independent medical specialist?
The Honourable Minister of Labour.
Thank you, Mr. Speaker. I don't have the exact definition of an independent medical specialist, but in terms of what the name says, they'd be independent. They wouldn't be subsidized by Workers' Compensation Board, but I can provide the exact definition that WCB qualifies that individual to the member. Thank you.
The honourable member for Pictou Centre.
Mr. Speaker, Daryl McKinnon, a Pictou County worker, was injured on February 13, 2012. 6.5 years since a workplace accident, he continues to be denied by WCB. Mr. McKinnon was sent by his family doctor to see a specialist about his injuries he sustained that day in the job. The specialist provided his opinion after seeing him numerous times and concluded, along with 4 other specialists that reviewed Mr. McKinnon's case, that indeed it was a workplace injury. So it came as a great surprise when the WCB officials informed Mr. McKinnon that they denied his claim based on a 5-hour visit from another specialist the WCB hired to review his file. My question to the Minister, can the Minister explain why the WCB waits to hear from a hired specialist rather than make a decision from several independent specialists?
The Honourable Minister of Labour.
Mr. Speaker, I'm not familiar with these particulars of this case. If the member would like to obtain a release from their constituent, I'd be more than happy to review it with them. Thank you.
The honourable member for Sackville-Beaverbank.
Thank you, Mr. Speaker. My question today is for the Minister of Education and Early Childhood Development, and is about local courtesy busing. Last September, I asked the Minister a question in regards to courtesy busing in the local Harry R. Hamilton schools, and that the distance, of course, set provincially is 3.6 kilometres. And students are bused from 5 to 18. The Halifax Regional School Board had a policy at 2.4 kilometres from grades primary to 6, which the Halifax Educational Centre seems to be still following. The Minister said that a standardization policy across the province is one of the objectives of centralization. My question is, will the Minister please update the House on whether centralization has resulted in a standardized policy across the province, or has he just helped to add to the crisis in busing for students in the Halifax Regional Education Centre?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. I appreciate the question. I know that for many parents, they experienced busing frustrations the first week of school. There has been significant progress made over the course of the weekend into this week. We are now at 98% of our students in HRM being delivered to school and back home on time. That said, we want to make sure that we do a better job moving forward on having the best busing practices and policies possible to ensure the health and safety of our kids and efficient delivery of our students. So we're currently reviewing best practices within Nova Scotia and our various regions, and also in the other jurisdictions of the country. Thank you.
The honourable member for Sackville-Beaverbank.
Yeah, thank you very much, Mr. Speaker. In September of 2017, the minister said that there are many people out there who would actually agree having their children walk to school was a healthy exercise. Then again in March, I asked the minister if he would commit to come out to my constituency and join me and a 5-year-old student as we walked the 7.2 kilometres to school and back. According to the Hansard, the Honourable Minister of Education and Early Childhood Development at that time replied with an unqualified maybe. My question is, will the minister today commit to come out and participate with me in some so-called healthy exercise by walking the 7.2 to Harry R. Hamilton and Wilson Lake subdivision and back again along Sackville Drive, where there are no sidewalks, very narrow road shoulders, and over 20,000 cars a day?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. Part of the review of busing that we're doing right now does entail the various distances that we have for elementary and higher grades in the province. We're also looking at the number of buses that we do have on our routes. I'll remind the member that those thresholds were brought in by previous Conservative government, and I think it is about time that we review those. The fact that we were able to change the governance structure of the education system has actually finally allowed the province to play a very direct and active role in this file. Thank you.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. My question through you is the Minister of Transportation Infrastructure Renewal. And I know as he and his department is starting to get ready for planning for 2019, I thought I would ask him a question of what kind of monies will be available for paving the Trunk 3 highways through our communities, the Trunk 1s, that secondary highway system that's so important to us.
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and the question is well put, and I thank you for the question. It is that time of year when we are determining where the budget is going for next year, and we've invited all the MLAs to avail themselves of the opportunity to put their particular opinion on what their priorities are directly to the department people who do the planning, and I would invite the member to take the opportunity to highlight the importance of Trunk 3 to our senior management. Thank you.
The Honourable House Leader for the Official Opposition.
Well, let me do one up. Let me get it onto Hansard, and I'll bring it to Hansard when I do have that meeting with you and your staff. As we flow through Shelburne County, as we come across the Shelburne-Yarmouth County line in Charlesville, there's the highway there, number 3, travels all the way to Barrington Passage. All of it needs to be replaced. That's about 20 kilometres of paving, which would take up all of the budget for Argyle-Barrington as it goes forward. So, Mr. Speaker, I just want him to understand, I want the Minister to understand that it's been neglected far too long. There's millions of dollars of lobsters and fish products that come through there that have to travel over that road, and it's becoming to a state that it is unsafe. So, Mr. Speaker, on Hansard, I'll bring this to the meeting, but maybe he can comment on the availability of Charlesville to Barrington Passage.
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker. And I was so happy to present the budget in this year's budget process last spring that increased our capital spending from $225 million to $287 million, a huge increase in our capital spend, unheard of and unseen in former governments, together with an increase of over $2 million in the maintenance budget, which hadn't seen an increase for quite a long time, over a decade. So in terms of the very good points that the member makes with regard to the condition of the highway and the importance of it for commerce, as all our roads are, it is important that the House notes that we are spending more money on capital than this province has seen in many, many years. Thank you.
The Honourable Member for Halifax Needham.
Mr. Speaker, my question is for the Minister of Lands and Forestry. Bill Leahy's Independent Forestry Review report has a clear message. If we don't start protecting the ecological underpinning of the forestry sector, we risk it all. this is not news. Commentators point out that Mr. Leahy's recommendations are not very different from the natural resources strategy released in 2011 after years of public engagement and consultation. The NDP began implementing the strategy, but the Liberals have refused to follow it. So my question is, will the minister admit that the Forestry Review report confirms that the government should not have backed away from the goals of the natural resources strategy?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker. And Professor Leahy did submit a report about 3 weeks ago. It's very comprehensive, but it does have a strict focus on the forestry industry instead of a full natural resource strategy. And there are 163 conclusions drafted, 45 recommendations. It's over 70 pages, so the department is ongoing looking at each recommendation, and we look forward to seeing if our analysis supports his recommendations. Thank you, Mr. Speaker.
The Honourable Member for Halifax Needham.
Mr. Speaker, 12 organizations representing more than 2,000 woodlot owners have had time to come together and decide to endorse the report, but we haven't heard anything from the government about what it will do. And in the meantime, the same practices that undermine the future of our forests are continuing, including a new announcement of 878 acres of Crown land proposed to be clear-cut. My question is, will the minister commit to implementing Leahy's recommendations?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker. Again, we will be looking at each recommendation and not just cherry-picking which ones we think will work well in the short term. There's lots of work to do.
Order, please. Time allotted for oral questions put by members to ministers has expired.